We know that half the world lacks access to essential health services. So how technology can close that gap and also solve systemic problems of trust and access is what we really want to focus on today. So to that end, and without further ado, I'd like to welcome our first guest this morning. Medtronic Labs is an independent nonprofit funded by Medtronic, operating in more than 200 sites across the world. Please help me welcome its president, Ruchika Singhal. Thank you. Welcome to Axios House. Thank you so much for being here with us this morning. And I should say congratulations. You were just named one of WEF's sister organization, the Schwab Foundation, where you were just named Corporate Social Innovator of the Year here this week.
Thank you. Thanks.
So I mentioned that half the world lacks access to essential health services. I think this room knows that. That's according to the World Health Organization. Just to start us off here, what else do we need to know about the scope of this problem of access to healthcare?
It's a huge problem, as they say, a wicked problem to solve, which requires all of us in this room to try to solve it. But, I've been thinking about this for my entire career, but our health systems are really designed for an era when it was all about treating acute injuries in the war. We set up hospitals for acute interventions, and as a society, as we've evolved, our health system hasn't kept up with that. And we cannot build enough hospitals. We're never going to have enough doctors and nurses. We've been hearing about staff shortages everywhere. So how are we going to solve that problem? And that's the reason why 4.5 to 5 billion people lack access to healthcare today, because we cannot keep up with building hospitals and training enough doctors. Technology, which has really dramatically improved in the last 30 years, has the power to change that, but we haven't even started to begin to harness what the potential of that technology is, especially digital tools for a lot of very basic care. So much of the health system has been focused on interventions for late-stage complications versus prevention and healthy living. So really fundamentally reimagining how does health care become about health and not about sickness is what we're trying to solve, and I think digital tools have the power to do that.
I want to get to some of those digital tools, but I want to ask you about trust and where just sort of, if we think about people who lack access, like are there systemic problems with trust? Do we think technology can help or hurt that? Where does trust fit into this conversation?
Trust is integral. I think, for all of us from all different sectors here, it can be really hard to talk to each other sometimes. For those of us in the private sector, I think when we meet with stakeholders in the government, there is an automatic assumption that you're all about profit. And even when you're trying to do something good, what is the underlying thing that you're trying to get at? And how do you bridge those things? I think for me, it's been very much, it's about the human connection and building those bridges, showing up, problem solving together, and understanding each other's needs and perspectives to co-design solutions. That's the first part of it in terms of working across sectors. I think the second part of that is the communities that we work in, because there's the lack of trust because of lack of understanding. In so many communities, patients, people, humans, we don't understand the new diseases that we're dealing with, especially in the communities where for the longest time infectious diseases have been really the paramount, like that's the problem we're dealing with. But now as it's evolving to more chronic conditions like cancer or diabetes, in a lot of the local languages in countries that we work in, there's no word for diabetes, for example. So people don't understand that. So and then you think about insulin injections, and there's this paranoia around like, oh, if I'm gonna get an injection, that means I'm dying, because every patient, by the time they got to the insulin injection, was already too late to make a difference for them. So how do you get that awareness and understanding to that population, like within the span of a generation where these things have become important? There's a community health worker role to that.
Well, and that's what I wanted to ask you about, because your open source digital health platform, how are you using that to integrate into community health? Can you share a little bit about that?
Yeah, absolutely. So, the premise that we've been working with is really that, in a lot of these places, the community health workers are becoming really the bridge between the health system and the communities, because they are from those communities, they're from those backgrounds, they understand the challenges and personally know all the people in the neighborhood. So it's one thing if I go to a doctor who I don't know, he or she might be in a city that's 5 hours away from me and has 5 minutes to talk to me, if even that, and tells me you should eat better and go away. I'm not going to listen to that. Versus somebody in my community who might be a few years older than me, who understands where I live, knows my family, and sits down and explains to me, like, hey, this is how you should maybe adjust your diet, or we're all getting together and going for a walk, or if you have fever, maybe consider doing something like this. It just has so much more power. And community health workers are that frontline agents that have been actually played a tremendous role in maternal health over the last 30, 40 years and are now becoming tasked with all primary care. So what we have been doing is really developing these open source digital platforms for that workforce, which has not even been formalized in most countries, but I think there's a huge movement towards that, and we're very excited about that. But giving them the clinical decision support and the knowledge so that they don't have to remember everything that you try to learn when you go to 4 or 5 years of medical school.
So how does that work? Yeah, so can you give us a practical example of how that works?
Yeah, absolutely. So, it's one thing if you expect a community health worker to, for example, know all of the signs and symptoms of hypertension or high blood pressure or diabetes. They're not going to remember. I can't remember any of that. But if I go and if I'm a community health worker and I have like a script to follow on an app where it tells me, ask this question, based on this is the risk profile of this patient. Based on this risk profile, and the last time this patient went to a physician, I know that it's been 2 months, their blood pressure has been high for 2 or 3 months, their medication was changed, but it's still not under control. I better spend more time and energy on this patient versus just going door to door and gathering data and reporting on all of that.
And does it actually sort of suggest that?
Yes.
Like it does.
So that's the workflow intelligence that we are building in, which is based on clinical guidelines, which is based on risk, which streamlines the work of the health worker, makes them more efficient, and helps to use those very limited resources to truly improve outcomes for patients, right? So we've been able to demonstrate that control rates for hypertension and diabetes are much, much higher in the patient population where we're managing these patients through these types of follow-up mechanisms. So it's a little bit of like, you don't wait for that patient to show up with a stroke.
Well, and also that the follow-up mechanism and sort of outcomes depend on these touch points.
Right. So at the clinic, then, the physician also knows that they were supposed to show up, and this is a high-risk patient who hasn't shown up. Can somebody please call this patient and figure out what's going on? Or there's been a medicine stock out, and these prescriptions have not been filled. What is happening with these patients who were super high risk? So, and based on that, the health system also is able to look at and say, hey, before, when I'm forecasting, I'm just like, this is my budget, this is the percentage of money I allocate. Now they're like, I know I have 200 patients, this is their normal prescription, I can bulk purchase, I can forecast better. I know that I need staff to take care of these urgent cases at these levels of facilities. So it just streamlines that entire system and is not dependent on hoping that a patient walks into a health facility.
Ruchika, we're almost out of time, but we have a couple minutes left, and I feel like I can't let you go without asking. I feel like everyone has to ask about artificial intelligence at this Davos.
Yeah,
but
absolutely.
how are you seeing AI? Like, is that also? I imagine that's also you're integrating that behind all of this system here.
So, so I think of it. AI is a tool. It's not the solution. And the way we're integrating it is to solve very specific problems. So things like being able to predict which patient is likely to default on their follow-up, on their medications. And we're realizing it's not the simple things. Like,
I was going to say, does it work? Is it?
Yeah, we've developed these predictive scores on which patients are likely to show up, not show up, and then based on that, being able to decide either we want to go after those
Right.
patients or not. That's up to the health system. That's not
Sure.
our. But yeah, those are the
And
types
do
of
you have a
things that
sense
we're
of how
doing.
accurate those predictive scores are at this point?
Not yet.
Okay.
I will let you know once we figure that out. But it's really thinking about that care pathway and where the problems are, thinking about like very patient-specific advice that, like a chatbot for the community health worker, for example, but that's customized to the patient that's in front of them so that it's just an assistant, right, for the health worker to have on demand right there. So those are the types of applications we're looking at.
One last question before we go. I want to end just on this trust point. Like, as we're thinking about communication around AI in the healthcare setting, how are you handling that?
We work closely with our stakeholders. So in every country that we are in, the government stakeholders, all of the people in the health system are very much involved in co-designing all of it, knowing that the regulations are not there. All of the challenges, whether that's around data collection, data processing, what we are doing with that, what type of interventions we're deploying AI in, they're very much part and process. And so hopefully that's all feeding into the development of regulations, and we're going to do it together. So,
Well, we'll have to leave it there. Ruchika, thank you so much for being with us. I appreciate it. Up next, my colleague, Nick Johnston.
Thank you, Nyla. I'm Nicholas Johnston. I'm the publisher of Axios. Good morning. Welcome to Axios House. We are in the home stretch, finally, of an incredible week here. Many incredible conversations, but we're not done yet. We've got an exciting bit of programming today. And of course, everything that we've done at Axios House this week would not be possible without the support of our partners. So very grateful this morning to have the backing of Pfizer to help make this conversation possible. And I'm very happy to welcome, for a view from the top conversation to this stage, Pfizer CEO, Albert Bourla. Albert, welcome to Axios House. Good morning. Let's start really big picture. Some of Pfizer's latest research has looked at trust people have with technology innovation in healthcare. Majorities of people view it positively. Tell us how we make sure we deliver on that opportunity.
I think developing trust will be an important component. I'm very enthusiastic about the technology of AI. I think will be transformative. Clearly, it's a very powerful tool in the hands of bad people, can do bad things to the world. A very powerful tool in the hands of good people, can do good to the world. I'm convinced that the benefits will outweigh completely the risks. So I'm not that much concerned if the technology will deliver. I'm more concerned if people will embrace it. And trust is a very important part when it comes to people embracing it.
Then how do you help people on that journey? Like I feel that's the theme here very much at Davos, is very much optimism about the opportunities here. But if you dig into the data, with 6 in 10 have trust, that's 4 in 10 don't. How do we bring the rest of that population along?
Yeah, you're right that 40% they have a low trust into this. I think you need to understand what is it that will motivate them, and you need to, education is number one. You need to focus on the outcomes rather than on the tools, and the outcomes could be very beneficial for them. And I think it is extremely important that you don't start with a machine, you start with a human face. I think those that they are having more mistrust to those technologies, they should see their physician use them rather than themselves using them. They should see people in their community using them.
That's what we just talked about here, is that
exactly
instead of like looking for people in the community who've maybe experienced that before, how can people not in that community though, how can large corporations who are leading that kind of innovative research encourage that kind of community participation? Tell me how you think about bridging that gap.
I think that it's not a job of one corporation, it's just the job of academia, it's not the job of journalists, it's not the job of the government, it's the job of everyone. Because again, we are all looking forward to the benefits that technology, that science can bring to all of us. But we need to do it all together. And this is the synergistic effect when people see that a whole set of stakeholders are all singing the same music, this is very important.
This is a joke I've been telling all week at Davos. I'm going to tell it again. The great thing about having conversations at Davos is that everyone in the room is either very important on the topic or thinks they are. So for that audience here that really cares about this,
They are the very important.
these are the very important ones. It was the other ones where they thought they were only very important. So for this crowd,
We are the ones that think.
exactly. When these people go back to their home countries, go out to their home communities, like, what is the call to action that you can give to them? What is the advice you can give them, the actions that they can take to help move this process along?
Try to understand it better and try not to be afraid. And those tools are so much available right now, widely available. And I think they should try to experiment themselves and try to see for themselves what those things can do. It's very impressive.
Is it very much like an issue of communication then? Perhaps it's like the danger here is for folks who are experts in the field. We see these innovations come and we just know almost intuitively, oh, this is how it works and these are the benefits from. Do we need to spend more time explaining it to people who are not experts in the field? Like, tell me how you think about that and how you feel a role as a corporate leader in doing that.
Look, when I think about the power of those technologies, for me as, let's say, Pfizer, I see it at two different levels. One, it is how those technologies can help me do my job better. My job is to bring breakthroughs that change patients' lives. That's why I exist. That's why Pfizer exists, right? So I think those tools can help us significantly bring better products faster to the world. Those are the tools that will help us bring cancer medicines. Those are the tools that will help us gain 2 years or 3 years of life in a patient, which may not look a lot to someone from the outside, but that could mean the difference for a father to live enough to see the graduation of the daughter or the wedding of the son. So these are extremely important things. Embracing those technologies within our corporation, I'm not that concerned because that's what we do constantly. Might not be in AI, might be in mRNA, might be in ADC, might be in all these new technologies that science brings to the world and we are using them. Our scientists are very familiar by using them. So on that front, although I keep educating the broad population of our company to the use of those tools, I'm quite confident that this will take off. But then there's another element, which is the element of the consumer. It is the element of the people that will receive. And our products will come to people that need to be diagnosed, that people that need to be selected, to be identified. And this is where AI, in the hands of physicians, can play a huge role over there.
I'm glad you mentioned AI. I want to come back to that. But first, I want to pause on something you mentioned, which I think is really interesting, and that's explaining it in the human terms. When you talk, you can talk about healthcare innovations in very broad, societal, scientific terms, but the phrasing you just used, helping a father spend more time with their daughter, is that an effective way, you think, sort of bringing it to the very personal as a way to get people to build trust?
That's the most effective way. And the worst thing you can do, it is to accuse those that they are not trusting as less educated, as you don't understand, you are misinformation, and that's not the way to discuss about those people. Those are good people that they don't trust, right? So they need to be convinced, and you need to approach them with real-life examples, and you need to show them how their life can become better with the use of those tools. Yeah.
So I think under Swiss law, we have to talk about AI during a panel at Davos, so I'm glad you mentioned it. Let's talk about it in two ways. First is, I think, the opportunity it presents. How are you already seeing it accelerate these technological innovations? How much promise does it give? And then I'm going to have a follow-up on the flip side. But let's start with the optimistic upside of AI.
I'm extremely optimistic. I believe that we are in the cusp of living a scientific renaissance. The life sciences industry, the life sciences ecosystem will deliver solutions for diseases that for many years we were trying and we couldn't deliver solutions. And that is happening not only because we have significant advancements in biology, but also because we have significant advances in technology. And the collision of the two creates synergistic effects. So I am very optimistic that in the next 10 years, starting with the next 3 months, all the way to the next 10 years, we will see significant advancements for the betterment of humankind.
I mean, I've spent a lot of time on this stage this week asking very smart people to put their prediction hat on, if we were to talk a year from now here about like what can we see very quickly? You mentioned 3 months from now we might see changes. What will we be talking about a year that AI has brought to healthcare innovation?
When it comes to the tools that are helping our scientists, it helps us do better medicines faster. Some of the medicines that likely without AI would come in 26 or 27, we can see them coming in 24, 25.
It's accelerating that innovative process.
Significantly.
But then I want to do the other side of that. What AI has a lot of promise, but a lot of peril. Not just being used for ill intent, but also uncertainty around it. People get nervous around AI. How do you communicate? How do you talk about making people feel more comfortable that, look, we're going to use AI to develop great drugs, but it won't create superbugs or antibiotic-resistant drugs? How do you balance that message?
Yeah, the risk is there, as I said. With everything that it is powerful, there is risk. Right now, with the current technologies, bad people can create biological weapons, right? The same scientist, good people, can create medicines that treat viruses. So it is not the science that it is the problem. It is bad people that are having malicious intent and they are trying to use it. The same is with AI. Without the power of that tool, we wouldn't be able to see the benefits. But of course, there is some concern that in the hands of people, it can be worse. That's why I think everybody now, it is trying to develop a framework, some guardrails. When I say everyone, I mean legislators, regulators around the world, of how that can be used. And there are two camps. I think those that they are more concerned how to protect society from malicious acts, and those that they are more focused on how to enable those tools to create benefits for the entire society. Yeah. And it's always important to find the right balance.
Really quickly, before we run out of time, I know you have to run down the promenade for the big stage, but thanks for coming by here first. I want to ask, what's a healthcare innovation in your life? Like we talk about bringing it in personal terms. Like, what's something cool that you've seen technological innovation change your life for healthcare?
I'm not that cool person, so it's not. I'm not going to impress you with that.
Nothing interesting?
I'm very basic.
Well, then before you leave, I want to ask one more question that you touched on, which I think will be very important when you go to the main stage, is collaboration. You can't do this alone. Talk about the role that you feel that governments or other stakeholders in this need to play along with healthcare companies.
It's extremely important, first of all. The government needs to set up the guardrails, as I said. They are responsible. It's not us, it's not the tech companies, it is the government. It is those people that have been elected to set the rules. And they need to do that in a wise way. They need to do that in a way that will protect against malicious acts, but also will enable good players to use those tools to create the good things that we all need.
Perfect. That sounds like a great message to bring down the promenade when you're on the big stage. Albert, thanks so much for being here today, and a big thanks for Pfizer for making this morning possible. Stick around. I'm going to bring Nyla up for one last conversation.
Hello again, and this time the mic's on. Okay, great. So for our final conversation this morning, we really wanted to zero in on what this conversation looks like in rural healthcare, particularly in the U.S. So I'm delighted to invite up our final guest for this morning, Bill Gasson, who's the CEO and president of Sanford Health. That's a South Dakota-based health system. Yes, please come up. Thank you. Thanks for being here.
Yes, thank you.
Welcome to Axios House.
Thank you. Pleasure to be with you.
So let's just talk a little bit about Sanford Health. You all have hundreds of locations across the upper Midwestern U.S. You're also a health insurer for people in that area. And I feel like I should add, when you came here, is it 60 degrees warmer here than in South Dakota? Is that accurate?
When I arrive, that's correct. I'm hoping when I get home, the delta is not so large.
Okay.
But yes, Sanford Health is the largest rural health system in the United States. And so we are headquartered in Sioux Falls, South Dakota, but we spread across 24 different states with 47 hospitals. We have hundreds of clinics, hundreds of long-term care facilities. And then we have the privilege of covering 225,000 members with our health plan as well.
So I am hoping you can start by giving us a progress report on your virtual healthcare initiative. That's something that you all first announced as a $350 million initiative that you first announced a couple of years ago and are a few years into, 2 years into implementation?
Yes, that's correct. We had the privilege 2 years ago of announcing a landmark philanthropic gift to Sanford Health, $350 million from our namesake and benefactor, Mr. Denny Sanford. And not that Sanford Health wasn't already involved in the virtual space, but the steps were very incremental. And with the advancements in technology and what we believed was probably our greatest opportunity to begin to bridge the gap for access, especially access for patients living in rural America, we believe that our most powerful tool is technology. And so the Virtual Care Initiative really allowed us to pour some jet fuel on that initiative. And so we through this last couple of years have really allowed us to begin to innovate more and more in that space and to really begin to extend some life-saving care in areas like obstetrics for some of our rural communities. Today, right now, we're using AI-enabled remote patient monitoring that's allowing us in rural communities for women who live in rural communities, that live in tribal communities, underserved areas, to now have both postpartum coverage as well as prenatal. And for us, that's really important. If you provide care in rural America today, you know that now greater than 50% of those hospitals no longer provide obstetrics. And so we see that as a really crucial opportunity for us to begin to continue to extend that life-saving care.
Well, and as we think about that, the maternal mortality rate, we know particularly when we think about rural or indigenous people, particularly women of color, how high that is in the United States. How is this helping?
Yeah.
Do you have a sense, and also statistically, how it's helping?
Yeah, as you had stated there, those challenges, and they're really predominantly challenges around access. So when we talk about some of our tribal communities, we talk about our rural communities, these are some of the most challenged and underserved communities that we see in the United States. And we see that one of the ways that that's manifesting itself right now are these just terrible outcomes for these women and their children. And so for us, that was one of our top areas of initiative, was to be able to step into that space to do that. We are seeing significantly better outcomes for these women and for their families as we begin to provide that remote patient monitoring for them. And what that also allows us to do is to really develop a relationship of trust with those families that then allow us to extend other care. One of the other areas that we're really focused on right now is extending endocrinology care into some of these communities. We have a physician of ours, Dr. Dave Newman, who now has transitioned half of his practice to being all virtual, which allows him from Fargo, North Dakota, to be able to extend care hundreds and thousands of miles away into communities as small as a couple hundred to a few thousand, to allow them to have access to this specialty and subspecialty care. That absent that, the ability to travel hundreds of miles to receive that care as they monitor and try and care for these individuals with a chronic disease is almost impossible. Not only can they not afford the travel, but it's difficult to find childcare. It's difficult to be able to find time off from work. And so it's helping us bridge that gap to really address that big issue around access.
You mentioned one of your doctors. I want to ask you about staffing, because when you think about you and I were talking earlier about how even before the pandemic, staffing was an issue. I want to ask you particularly how you're sort of navigating staffing shortages. I wonder if you thought when you became the CEO that you would be dealing so much with immigration and visa issues, because I feel like you probably spend quite a bit of your time with your job dealing with these things.
That's correct. I was hoping to be farther down the road as a recovering lawyer when I stepped into this space, but fortunately I've been able to draw on some of that as we've gone through these very difficult times. And as you talked about there, when I had the privilege of transitioning into this role in 2020, at that time, in addition to the pandemic, workforce was one of our most difficult challenges that we face. As we start 2024, that again remains one of our chief challenges. And as we look to address that, we've really looked at a number of different ways. We have been fortunate to benefit from some really good relationships with international trained and born nurses as well as physicians. But as you stated, we've run into some challenges of late with some of the immigration laws in the United States that have not allowed us to gain access to some of those individuals. So as we've done that, we've really worked alongside some of our key elected officials who, especially here in the upper Midwest, North Dakota, South Dakota, and Minnesota, have really come alongside and helped us advocate for and to even sponsor some legislation that we're hopeful is going to allow us to recapture some unused visas over these last couple of years so we can start to bring in more of that workforce. But at the same time, we know that it's not a one solution issue. And so once again, we actually see as our most powerful tool to address that workforce shortage to be leaning into the advancements of technology, using AI, using generative AI to be able to help address some of these issues so that we can make sure we meet patients where they're at and provide them with that world-class, life-saving care.
I want to get to the AI in a minute, but I just want to ask you again on the staffing. Can you give us a sense numerically of like visas, how many you need, how many you get?
Yeah, maybe here a great example. So if I sit here today, right now I have over 1,000 open RN positions. And so for those of you that have the privilege of serving in healthcare, you know that your nursing workforce along with your physicians, they're the backbone of what you do. So that's a greater than 11% vacancy that I have right now in the system. And so we were fortunate enough to develop a relationship, and we contracted for over 900 of these internationally born and trained nurses to come over and work with us. And we've had a great experience over the years. These are very talented, very dedicated, incredible caregivers. Unfortunately, because of the stopgap or the stop that's happened with immigration, we have only 300 of those who are here with us. So where we end up with is this gap. I have over 1,000 open positions. I have over 600 of these incredibly well-trained, dedicated individuals across the border who want to be able to come into the United States to be able to provide those services. And it's not just on the nursing side, but also on the clinician side. Right now, 3 of the 5 areas within the country that have been designated by the United States federal government as being provider shortage areas are in rural communities. So access to those J-1 visas, access to those H-1Bs are critically important for us to continue to provide that world-class care to our patients. We believe at Sanford Health that every patient, regardless of their zip code, deserves access to world-class care.
So with that gap, as you think about generative AI, other technological tools, obviously you don't think that can help like solve this completely, but how much does it help alleviate some of this?
You're correct. As you've heard some of my other colleagues up here this morning, there's not a single solution. We do believe, though, that that probably stands to be the most powerful solution to addressing those needs. And as we look at that, it's access. I'll give a great example that we have. Right now, as many know in the provider space, there is a significant backlog for access to colorectal screening here across the United States. A number of compounding factors. 1, there's a shortage right now of GI physicians in this country. 2, we had significant challenges through the pandemic that resulted in a lot of individuals who would have otherwise come in for some of that preventative screening that haven't. And then thirdly, the protocols have moved from age 50 down to 45. That created this compounding effect of a number of individuals that need that very important screening. So what we've done is we've leaned into the advancements of technology. We've developed with our advanced analytics team an algorithm that allows our physicians to be able to prioritize those patients, to determine which patients are in the highest need of receiving a colonoscopy and which patients are otherwise better served by having a stool sample screening to allow them to make sure that we are able to identify if they have an issue that we need to intervene on sooner rather than later.
You mentioned the pandemic. How concerned are you that there were certain, within the US, there were certain telehealth requirements that were waived when it comes to the pandemic, making virtual healthcare a lot easier? Those were not permanent, but with Congress.
That's correct. And my hat's off to our elected officials, the administration, that during the pandemic did see fit to advance those waivers. Where I sit here today, I'm a very strong advocate of making those permanent. Those did allow us to really accelerate the advancements, and I think to really begin to capitalize on the opportunities to really meet patients where they're at, to close the gap on access, to improve outcomes, and to provide some relief to our physicians, to our nurses, and our other clinicians who are very tired, who are very taxed right now. And so making those permanent would be a fantastic way for us to be able to continue that and to continue to build on that success of being able to reach each one of our patients where they're at.
We're almost out of time. I just want to ask you one last question as you've been here. What's kind of been the most surprising thing that you've learned that you're going to take back with you?
I think here in my time at Davos, it's been very rich for me to be able to sit around and listen to individuals, both within the healthcare space, and as we heard this morning, in other areas within Pfizer or Medtronic Labs, but then also outside of the healthcare industry, to see that a lot of the challenges that our leaders across this world are facing are very similar to the ones that we're facing right now within healthcare. As it looked to the opportunity with the advancements in technology, we know that trust is paramount, and I'm hearing that across sectors. It's governmental, it's from a healthcare perspective, it's from a security perspective, the financial areas, and so we really see that coming alongside, working closely with our elected officials to make sure that we instill confidence with them, that we work closely together to promulgate rules and regulations that help us to maximize our potential, but to do so within some very safe guardrails is important. And I'm grateful for a number of my colleagues, both on the payer and the provider side within the United States, that allowed us to come together the last part of this year, to create a voluntary commitment. Over 30 health systems of providers and payers came together, and we submitted what we refer to as our voluntary commitments around the responsible use of AI. And we think that that's very important to building trust for our patients. We think it's very important for building trust with the administration, and very important to build trust with our providers, that they know that we see this as a great tool. It doesn't replace our people. It comes alongside, it augments, it supports them. And at the end of the day, this is another tool for us to be able to provide world-class life-saving care.
Bill, thank you so much for taking the time to join us here at Axios House. We appreciate it.
Thank you very much.
Thanks to all of you for being here with us this morning. Please stick around, network, enjoy, have some cupcakes that look like they're back there. So enjoy.